Welcome to Academia, and Academia Answers Medicine, November 2020, multiple choice. GNC past paper question, and we are going to be given just question, answer, so that at least we cover many questions. Then on your free time, you can now seek for explanations. Corrections are also accepted. There we Question 1 says, a nurse is directed to administer a hypotonic intravenous solution. Looking at the following labeled solutions, she should choose. The answer is A, 0.45 sodium chloride, because that is the one that has lower concentration, in its solution to say. Then question 2 says, one of the dangers of treating hypernatremia is what? It leads to red blood cell crenation. So the answer is A. Red blood cell crenation. Then question 3 says calcium gluconate should be administered to a patient with severe hyperkalemia in order to do what? To prevent transient renal failure. The answer is C. Then question 4 says nursing assessment for a patient with metabolic alkalosis includes evaluation of laboratory data for all of the following except which one? Answer is D, hypoxemia. Question 5 says the liver plays a major role in glucose metabolism by producing ketones, then C, synthesizing albumin, then D, participating in gluconeogenesis. So the answer is C, participating in gluconeogenesis. Then we've got question 6. It says hepatocellular dysfunction will result. So basically, that is the liver. Liver cell dysfunction will result in all of the following except which one? So the exception for question 6 is A. Decreased serum albumin. Then 7 says the most common single cause of death in patients with liver cirrhosis is what? So the answer is question 7. The best answer is B. There we go. A clinical manifestation not usually associated with hypothyroidism is pulse rate below 90 beats per minute. Yes, that is even the answer. So question 8, the answer is A. 9. The major symptom of pancreatitis is what? Severe abdominal pain. Question 9, the answer is A. Right. Question 10 says the nurse should assess for an important early indicator of acute pancreatitis by looking out for an increase in, according to the options there, that is white cell count. White cell count. Sorry for those errors there. Question 11 says a major manifestation of uremia is what? So there we go. Question 11, the answer is A. A decreased serum phosphorus level. Then 12 says the patient with chronic kidney disease is most likely to complain of. So question 12, the best answer is D. High uric acid level. Question 13 says during peritoneal dialysis, dialysis urea and I'm sorry, I can't see properly there, pass through the peritoneum. So basically they are looking at the movement of substances, and we all know that particles actually move from the region of higher concentration to the region of lower concentration. So the basic answer there is B, diffusion for 13. Yes, for 13. I'm sorry, the paper is not that clear for me. I'm struggling to to see the questions. Okay, all right, there we go. The most common organism responsible for urinary tract infection in the elderly and the neonate, Mbakalamba and also Mubaiche. Answer kuli 14 B. Okay, that is B. 15 says the nurse should advise the following to be avoided in patients with the, okay, I can see properly there. Okay, that is pruritus, yes. Okay, so basically the best answer for 15, it is C. Okay, vigorous towel drying. Okay. There we go. Okay, I'm trying to magnify the paper so that I'm able to see it properly. You forgive me there. Okay, let's just continue so that we save time. Okay, 16 says the following are the most symptoms of pruritus except now. There's an exception there. So we've got rash, itching, irritation, and pain. The answer to 16 is B. Okay, itching. Then 17 says the most common fungal infection that frequently affects athletes is what? The answer 17 is B. Okay. Then 18 says a patient is complaining of severe itching that intensifies at night. The nurse decides to assess the skin using a magnifying glass and a pen light to look for the itchy mites. The nurse suspects the skin condition known as okay, so we've got contact dermatitis and so on. Okay, yes, I was actually looking for it. That is scabies. The answer is C. 19 says which of the following fluids is not associated with the risk of blood-borne transmission of the infection? It is urine. Okay, urine. Understand the question, huh? Basically it's urine. 20 says the loss of elasticity of the arteries due to generative, I'm sure, changes is called what? That is called the arteriosclerosis. So the answer is C there. Okay, the answer is C basically. Let's continue. Okay, yes. Then 21 says the pain of angina pectoris is primarily produced by. So the answer to 21, we've got coronary vasoconstriction, movement of thromboemboli. Then C, we've got myocardial. I'm sure that is a word. And the presence of the atheroma. So basically 21. The best answer is C. Okay, myocardial ischemia. Then 22 says the following categories of medicines are used to treat hypertension except which one? The answer is A, Dialysis. Then 23 says which one of the following is the antidote for carbon monoxide poison? Now, how can you prevent or rather treat carbon monoxide suffocation in a client? You administer oxygen. Okay, you administer oxygen. So basically the answer is oxygen therapy. Carbon monoxide is produced when there is incomplete combustion. Okay, so when there is complete combustion, then there will be the production of carbon dioxide. Now that one is a poison, carbon monoxide. So the best answer is oxygen therapy. There we go. 24 says when assessing vital signs in a patient with permanent pacemaker, the nurse needs to know the, okay, we've got date, time, session. Okay, so the nurse must actually know what is called the pacer rate. Okay, the pacer rate. So the answer is D. Is D, yes. An example of potassium sparing diuretic that might be prescribed for a person with congestive heart failure is what? Doctony. The answer is C, 25. Yes, 25C. 26 says the most reliable sign of cardiac arrest is what? Okay, is what? Okay, is what? So we are on the most reliable sign of cardiac arrest is what? So we've got, yes, there we go. I was actually looking for it. We've got what is called dilatation of the pupil. Okay, dilatation of the pupil. Okay, the answer is C, 26 years. 27 says, which of the following, sorry friends, my sight is very, very bad actually. 27 says, which of the effects, yes, should the nurse be aware of the patient on prolonged oxygen therapy? So the nurse must be aware of infection. Yes, infection. It's correct. The answer is B. 28. Which one of the following foodstuffs should be recommended in a diet for a patient with iron deficiency anemia? So we all know that condition, and the best answer is B. Okay, milk and cheese. Why? Because they really contain a lot of iron and other nutrients. Let's go. 29 says the chilling test is used to diagnose. Okay, so we've got aplastic anemia, then iron deficiency anemia, megaloblastic anemia, then pernicious anemia. Okay, so this kind of the test, it really go well with the pernicious anemia. Okay, so the answer is D. 30 says the human body uses one of the nutrients as fuel to drive its chemical processes. We've got fructose, galactose, glucose, then sucrose. So from the options given, the answer is C. Okay, is C, glucose. Right, glucose. Then 31 says the following are chronic obstructive pulmonary diseases, except which one? We've got asthma, bronchitis, pneumonia, tuberculosis. So which one is not, okay, is not a chronic obstructive pulmonary disease there? Okay, so we've got it under 31. The best answer is B. Okay, the best answer is actually B, bronchitis. Yes. Now, 32 says the intestinal phase of gastric secretion is stimulated by, okay, this is actually self-explanatory. Okay, for 32, the answer is D. Okay, the answer is D there. None of the above. Sight of food, smell of food, thought of food, vane. The intestinal phase of gastric secretion is stimulated by sight of food, smell of food. No. So none of the above. The answer is D. There we go. Allergic rhinitis is induced by, okay, we've got that is airborne pollens and the motes, then ingested foods, okay, parenteral medication, and the tropical creams or ointments. So the best answer for 33 is A, airborne pollens and motes. Okay, 34 says the etiology of Cryptococcus, okay, neoformans is believed to be A, environmental, B, fungal, then C, immunosuppression, then D, all of the above. So 34, the answer is B. 34, the answer is B, fungal. Then 35, characteristics of Mycobacterium tuberculosis include all of the following except which one? So that is 35. So 35, the answer is can be transmitted only by droplet nuclei, is able to lie dormant within the body for years, is acid fast, survives in an aerobic condition. The best answer is, the exception to say, sorry, can be transmitted only by now remember it says only by droplet nuclei. Huh? So that is the answer actually. Okay, that is the answer. 36. Which of the following techniques of physical examination the nurse uses to assess the level of patient's personal hygiene? Is it auscultation, inspection, palpation? None of the above. 36. 36. The best answer there is B. Okay, you inspect. Takwabo kuyayikata nga balasamba wayikata paskini tuba kuikata baloma. You may be actually told you go but you mwale for raping our client. So tet mule ya mkuu kubekata oloku ukumfwa ishiwi no kumfwa ishiwi nga balasamba takwaba. You just need to inspect. You look okay and see for bademoneka nga kudi kusamba. So basically that is simple psychological question. That is B, inspection. So 37 says a student needs to elicit the sounds of abdominal cavity on a healthy adult client. On auscultation, which sound will be elicited denoting peristaltic movements of the bowels when the client is lying in supine position? Is it a dull sound, a flat sound, tympanic sound, or none of the above? So 37, the answer is A. Okay, dull sound. Then 38 says, an adult male patient comes to the medical clinic with the hemoglobin of 7 grams per deciliter. Right? Then this should alert the nurse to assess the signs and symptoms associated with what? So you look at the level of hemoglobin. So the best answer there for 38 is A, hypoxia. Okay, the best answer is A, and that is 38. 39, it says a diabetic patient is admitted to the hospital with a blood sugar of 320 milligram per deciliter. The nurse decides to monitor fluid intake and output because A, decreased blood. I can't see that word. Oh my god, I can't see it. Okay, decreased blood. Okay, that is osmolarity. Yes, molarity coming from the word mos. Okay, causes fluid to shift into the intestinal spaces, resulting in polydipsia. Then we've got polydipsia occurs when glucose catabolism is accelerated, thus increasing the body's need for fluids. Okay, now from the understanding here, 39, from the understanding there, the best answer we can go for is B. Okay, whereby many sugar of 320 milligram per deciliter, that is basically found in a diabetic patient, is admitted to the hospital with a blood sugar of that, remember. So the nurse now decides to monitor the fluid intake and output because of what? So there is going to be the polydipsia occurs when glucose catabolism is accelerated, thus increasing the body needs for what? Fluids, meaning bambo kumfwechila kanomba, there is drastic thirst there. So ichinga bambo kuchita monitor nshwashwa kubata baklanti chishinga na batitashani na balwala. So you basically monitor that. Yeah, okay. So the answer is B, yes. 40 says nursing care for a patient with a fever is best. Okay, based on all of the following body responses except what? Okay, except diaphoresis, B, increased heart rate, increased nutrient catabolism, then D, vasodilation, okay, vasodilatation of surface blood vessels. So nursing care for a patient with a fever is based on all of the following body responses. Which one is an exception? That is question 40. So question 40, the answer is D, vasodilatation of surface blood vessels. 41 says genetic disorders arising from the inherited traits includes all of the following except which one? Is it hemophilia, meningitis, and C, feeling like a tune, whatever. Okay. Was temtem. Okay, so sickle cell anemia. Okay, so from the options given, they are saying genetic disorders arising from the inherited traits includes all the following. Okay, so we've got phenylketonuria, then meningitis, phenylketonuria, then sickle cell anemia, then hemophilia. So the best answer there is B, meningitis. All these that have remained, these are genetic disorders that arise from the inherited traits. So the answer is B. Let's continue. 42 says Mrs. Cavale is diagnosed with acute gastritis and asks the nurse the meaning of her diagnosis. Okay. Then then the nurse explains that the diagnosis is an inflammation that. Now let's understand something here. This woman, Mrs. Cabale, is diagnosed with acute gastritis. So now she wants to know the type of the diagnosis that was done. So A, the option says may be present for several weeks, 2 months, depending on the causative organism, will probably result in permanent epigastric discomfort. Then C is, oh no, can't see that word, or debilitating, I'm sure, and has a long-term effect, will subside with treatment and normal function will return. Okay, I'm trying to understand and analyze the concept that was used on 42. Yes, so I'm sure and very convincing that the response of a nurse could, she can actually explain to say that will subside with treatment and normal function will return. So that mwachitale anxiety aba patient aba mayo aba, because nga mwamba okulanda okuba bati no, it takes time abantu balesa mu kufulungana, staying with the condition for the longest period of time, they would actually bear no trust in you. So for you to develop trust from them to you, you got to tell them they'll be okay. So the best answer is D actually. Okay, if there are other options, you can state them out. Okay. 43 says, which of the following statements best describes the location of the human heart? That is anatomy, yeah? That is anatomy. If I remember in anatomy here, 43, it lies in the thoracic cavity of the trunk. Yes. The answer is A. Okay. Okay, 44 says, the P wave, a small upward deflection on the electrocardiogram ECG, represents what? That is self-explanatory, friends, and it represents arterial depolarization. It's okay. So the answer is A. Okay, the answer is A. Question 45 says a condition in which there is chronic non-productive cough associated with progressive dyspnea and fever is known as what? Now look at those are signs. So you've got none, it is chronic, and it is non-productive cough to say there is an occurrence, and it is associated with progressive dyspnea and fever. There is fever also. The answer is D. That is pneumonia. That is pneumonia. Answer is D. Okay, let's proceed. Okay, question 46 says the primary presenting symptom of emphysema is what? A, chronic cough, shortness of breath, tachypnea, then wheezing. Now they are talking about primary presenting symptom of emphysema is what? Okay, not secondary but primary. So 46, the best answer is B. Okay, the best answer is B, shortness of breath. 47 says the sudden loss of blood flow resulting from the failure of the heart to pump effectively is called what? Okay, dash is pump failure that primarily occurs as a result of cardiogenic shock, cardiac arrest, heart failure, and none of the above. So 47, the answer is A. Okay, cardiogenic shock. Okay, then 48 says all of the following are consequences of diarrhea except what? That is 48. So 48, the answer is D, except for hyperkalemia. All these that basically remains are the consequences of diarrhea. So the answer is D. 49 says which of the following drugs is best suited to treat cryptococcal meningitis? So we've got these types of drugs: penicillin, amphotericin B, then miconazole, then chlorophenol. Okay, so the answer to 49 is C, amphotericin B. Then 50 says a 25-year-old man accidentally swallows a 1 kwacha coin which ends up in the airway. In which part of the lower respiratory tract is the coin most likely to lodge? Airway. So it will be in the left bronchus, right bronchus, then C, esophagus. This is none of the above because they are saying in the airway. Okay, airway is the trachea there. Okay, it is the trachea. So basically these are the answers to medicine, friends. Otherwise, thank you so much. God bless you abundantly. This was Mr. Malambo, and wish you all the best even as you revise through medicine. May God bless you abundantly. Share to other people, even on our YouTube, our page, and even our WhatsApp groups where we have lessons from. Thank you so much. Bye.